I was trained at the premier institutes in this country. I was a professor of surgery at St. John's Medical College, Bangalore, then heading the department at the Majumdar Shock Cancer Center in Bangalore, and now the clinical director and head of breast cancer surgery at the Cytecare. I was trained in Bombay, and I was one of the last students of my uncle, who was the first Indian MS, and became the director, became the dean of KM and Nair Medical College later. He was Dr. Stanislaus Patrao, and I was very interested in anatomy. He noticed this, and as I was assisting him and being trained by him, he turned around and said, "Tony, why don't you think of taking this specialty?" So initially I was reluctant, thinking that it was a field where 35 years ago, when I thought that there was no cure at all. But then he said, those days he said, "Tony, remember, things will change and we'll find much better cure rates. Go into this field." And that's the reason why he introduced me into the Tata Memorial Hospital, and that was the place where I got inspired into the field of cancer. To be very frank, my wife was a great support. Till the age of around 45 in this field, I was in an academic position, drawing a salary. I did this only with the love of learning the subject, learning surgery, improving my technical skills. All the time I was in teaching institutions, and she supported me all through. It is just the thought of relieving somebody of their pain and agony. This should come from within yourself. Fortunately, I've had very good teachers. These were people who influenced you. My daughter has finished her medicine with all interest in the field of medicine. But one thing she really detests is to follow her father's footsteps. She prefers jobs like emergency medicine and critical care. So she was never interested in surgical oncology. Never carry any problems home. Second, I love music and I love golf. Any little chance I get to relax, I relax in the golf course. I play golf at least twice a week, and another 2 days I practice golf. In addition to this, I love music. Whenever it's a hard, strenuous day, I quietly go and listen to a lot of classical music. If you really ask me, I am disillusioned to a very great extent, seeing the unethical practices going around or being practiced by medical people today. It is sad to say this. So if I have to face this for another time, I will never ever get into this profession. I would love to go into fields which are closer to nature, like agriculture, or go into sports. You never got to frighten them with the side effects of treatment. You tell them, explain everything to them, but all the same, you give them solutions. Don't leave them with only the problem to think about. For example, all my patients, above 70% of my patients, go through immediate microvascular reconstructions after a mastectomy. I don't leave other than those patients who are very old, moribund, who will not stand a reconstruction. So most of my patients go through immediate reconstruction. On the other side, I try to do the maximum amount of breast conservation surgeries, where you really don't need to mutilate the breast with newer oncoplastic breast surgery techniques. I tell them to think it over. If needed, even consult somebody else, and then get back to me once he's really convinced of my advice.
His smile and his approach is so encouraging that his compassion and his confidence and also his sensitivity comes through, and he'll always make you feel very confident. He will not make you feel frightened at all. He is so compassionate and he is so understanding about the sensitivity of women, especially, that he will make you feel and you will leave his room with a smile.
I am here today only because of Dr. Anthony Pais. I was diagnosed with breast cancer almost 7 years back, and I felt really devastated when I heard first time that I had cancer. But when I spoke to him, he gave me a lot of hope, and I realized that definitely I can also come out of it. And the best thing is, when I called him first, he was not in India. He was outside India. Although he was outside India, he picked up the phone and he said, "Millie, don't worry, you'll be fine." And that gave so much of hope. And he was so compassionate. And when he came back and I met him, I realized that this is the person really I want to be in guidance with. And he treated me so well. He explained me everything so well. And when somebody is treated with cancer, the first things comes to mind: how long? How long am I going to survive? What will happen to me? A lot of questions, what, when, how, and why did this happen to me? So a lot of things comes to the mind of the person who is suffering from cancer, who is going through cancer. But he made it look so simple, and he was absolutely so good at explaining everything about the surgery, about the side effects, about the whole treatment, and what to do, what not to do. And it was not only during the time of surgery, but cancer is a long process. So it takes almost a year. For some, it may be more. It varies person to person. But throughout the period, whenever I needed any guidance, whenever I needed anything, any small query, why I'm losing hair so fast, or why my nails become black, all those things during cancer treatment, it happens. And he would always answer. Although sometimes he is in the operation theater, he would come out and call us back and inform us, okay, don't worry, this is what happens during treatment and you'll be perfect. So I don't think many people do that. So he was absolutely amazing, and he is my godfather. And because of him, now I am working in Cytecare Cancer Hospital. Because of him, I am into medical field. I am in this industry, and I always owe my life to him.